Welcome to Real Recovery Unplugged, the podcast where healing meets hustle, faith fuels purpose, and real stories spark transformation. I'm your host, Dr. Haley Brown, founder and CEO of Real Recovery. I'm an osteopractor, entrepreneur, believer, and someone who's passionate about rewriting the script on healthcare one life at a time. Each week, we'll pull back the curtain and have raw, unfiltered conversations with our staff, doctors, fellow healthcare providers, athletes, patients, and inspiring voices from all walks of life. We'll also get a behind-the-scenes look at what it really means to build a movement, not just a business. So whether you're a provider, a patient, or someone chasing a purpose bigger than yourself, you're in the right place. Let's get into it. All right, you guys, so welcome to another episode of Real Recovery Unplugged. And we're going to call this one the ladies of Real Recovery. Shout out to Dr. Tiffany also, who couldn't be with us today because her son is having orientation because school is starting back. So kind of our purpose for today is just to let the people know who we are, right? I feel like I'm always on videos and things like that because I just don't stop talking, but everyone wants to know about Dr. Nicole and our newest addition to the Real Recovery fam, Dr. Diana, who just passed her boards. We'll have to get that board in this video in a little bit. So I think it'd be cool if we just kind of talked about like how we all came together. Like how did all this happen?
Well, about 38 years ago in 1988, I was born. No, we met, I'd say about 10 years ago, close to that.
I don't think.
Decade.
Maybe like 7.
Okay.
Years ago.
Okay. Well, I'm
Don't
aging
age me
myself
yet.
already. I'm the old one of the group. But we met at a physician-owned practice, doing the grind of physician-owned practices. And Haley was a student from FAMU, where Diana just graduated. So FAMU representing in the house. I graduated from USF, and it's been, almost 13 years now for me, right? Am I doing math correctly? I don't even know. But I had a love for physical therapy ever since I was actually in high school and didn't want a desk job and loved anatomy and just was hooked on whatever job could intertwine both of those.
Yeah.
And I actually started doing an externship in high school and just kind of never looked back, and my life led me here. Yeah. Eventually, when we met some 7 years, maybe whatever year ago, and we were like, this physician-owned practice stuff isn't for us. I left because of COVID and kids and other things and thought I was never going to go back to physical therapy because it was just draining on me.
And then I made you drink the Real Recovery Kool-Aid.
Yes, and it was what therapy should always be. And now I'm hooked and I'm back.
Yeah. So student to mentor, then led to colleagues and coworkers, which has been so much fun. And then Dr. Diana, actually, this is a good question. What was your first impression of me?
Okay, so on the first day of class, so I'm an athletic trainer too. And the first day of class, Dr. Haley was like, is anybody an athletic trainer? So I raised my hand, and you were like, what is athletic trainers? What do they hate about physical therapists? And I was like, I don't know. I don't have any beef.
First day of class.
I don't have any beef.
Tell me what you hate
So
about
Diana
me.
when Diana was in the doctorate of physical therapy program, I'm the adjunct professor for the orthopedic courses. So this is like day 1 of like fall semester as she's a student.
Yeah, so I was just kind of like, I don't know. And then you started talking about dry needling and everything. I was like, okay, she might be cool. I'll give her a chance, I guess. And so she was my professor for how many classes? 2 classes?
Yeah, because you're my first cohort, so I didn't have you guys for the full go. So yeah, Ortho 2, Ortho 3.
And then I was lucky enough to be Dr. Haley's first student for my spring clinical rotation. So that makes Dr. Nicole like
Grandma, yeah. Oh,
it's your PT grandma. I love it. We have 3 generations here at Real Recovery.
And then she just couldn't get rid of me from then. And I just kept coming back, and now I'm here full time now.
And here we are. So yeah, I think it's actually really cool that we all have like mentorship stories with each other. And now like, I think it's so cool because I'll meet so many other doctors of physical therapy, chiropractors, other physicians, athletic trainers, personal trainers, anything like that. And you can immediately tell if somebody just kind of goes through the motions, or if somebody is like excited, eager, ready to push boundaries, ready to grow. And like, that's exactly how I would describe like the two of you. And like, those are big, like standout qualities. And I think that's why, you know, at Real Recovery, like when you come in here and you see one of our providers, doesn't matter which doctor you see, it is absolutely somebody who is passionate about what they're doing, who is pushing the envelope, always being creative, coming up with new ideas. And we're actually super excited because Dr. Diana here, especially with her athletic training background, is going to be introducing a whole new realm of services to Real Recovery. And she's going to be our concussion and vestibular specialist.
Very excited about it.
Yeah. So what would you say kind of like has you passionate about like working with concussion and vestibular based patients?
I think, well, first of all, I don't think that concussions are as respected as they should be as an injury. I think people are like, oh, I got hit on the head, I had a headache for a little bit, I'm better now. There's so much more to it. There's so many more symptoms that are overlooked, and you're like, wow, I didn't even piece 2 and 2 together. Just things like that. And I had concussions in high school playing volleyball growing up, and it was always like, oh, how do you feel today? And I'm like, I feel good. And they're like, okay, can you run for half an hour without getting a headache? And I'm like, yeah. They're like, okay, go back to practice. And that's not how it should be. There should be way more in-depth, way more personalized than just a generic return to play. So I'm really passionate about, really passionate, sure.
And some objective measures, not just an athlete lying to get back on the court. Because we were all athletes who hasn't lied up to get back to play.
Yeah, so I'm really passionate about getting baseline testing, so your normal testing, what you look like every day, because for every person that's different. For some people every day, they have a little bit of a headache, or they have something else in their life that makes them nauseous or something like that. So it's good to get a baseline. Some people are just naturally clumsy and don't have good balance. And so if you have poor balance and I'm looking at you after you just got hit in the head, I'd be like, you for sure have a concussion. But if that's just your normal, then it might not be so.
We accept
so
everyone
bad.
here at Real.
Good.
But then if there is an injury sustained during a game or something like that, then we're able to go back to that baseline testing and just take a look and compare, just so we have something to compare it to. And
it's crazy with concussions how many body systems are affected, and that's kind of what the new research is showing. Is it was just, are you dizzy or are you not, or do you have a headache, or did you lose consciousness? But I mean, now we understand how whiplash works. We understand how the gut is actually affected when you have concussion injuries. We understand how your vestibular system is connected, how your muscular system is connected, your vision. There's so many intricate, your autonomic system with your heart and how all that's connected. So it's a fun thing. I'm excited. The fun thing too about Real Recovery is, even though I am the grandma, like, I'm learning from the students as well, if you want to call you students. That's what's great when you have people that are passionate, because when you find passionate people, you do get to learn from them. It's never, your education's never done.
Exactly. And it's not cookie cutter. Like, all of us treat differently. We could all see the same patient and have 3 different plan of cares, but they all are going to be wrapped around the Real Recovery principles of definitely utilizing manual therapy, because so many PT mills are kind of slacking in that department. So they're not doing anything to actually help the patient get out of pain. They're just like, here's these exercises, have a good one. Doesn't really matter if they got better or not. It just matters how many they saw.
Company doesn't care about that.
Right. But then, to kind of take it to those next steps. And so it's cool because, I'll get a patient in and they just really want to like dive heavy into the sciences of like gym programming and how to hit this hypertrophy within this time frame, or balance out asymmetrical process. Like, we've had bodybuilders who, because of an injury, have one arm larger than the other, and that's a huge deal in their sport. And the second I get that patient, I'm like, it is so nice to meet you. Here's Dr. Nicole. Totally offload it. So Dr. Nicole, how did you get into like programming, strength? I mean, I call you the strength guru of Real Recovery. So where does that passion come from?
From, again, movement. I was a swimmer in high school and then kind of got burnt out from that through the high school process. I mean, I was swimming 5 hours a day and kind of missing out on all the things that high schoolers miss out on, like prom, all the things. So in college, I was like, I'm going to go do triathlons. And I got injured a little bit more because my body was used to swimming so much. So I started weightlifting in order to get stronger to support my sport a little bit, and kind of fell in love with the gym and movement in that kind of way. School does not do a really good job. I think we can all agree on how to teach exercise.
We are trying to change
Yes.
that. There's exciting things happening within at least Florida A&M's DPT
Yes.
program.
Yes.
But yes, across the board nationally, I think every PT can agree.
But yeah, I mean, a lot of bodybuilders will go to a physical therapist and be like, you don't know.
Yeah.
So, yep. And so like, that was pretty evident too among just the profession when I would go to places. So getting more involved in the bodybuilding, and I'm not a bodybuilder, but like following bodybuilding accounts, following different kinds of things and doing kind of my own education, and then knowing the science behind those movements was like mind-blowing as a professional, because not only am I able to decipher what's fake science and real science,
Yeah.
but like kind of nerd out on the movement and how it all interconnects when I'm reading research.
For sure. And I mean, like, you know, and I did a bodybuilding show, I think like 3 years ago now. And even then I didn't do my own programming for that. I also was eating very few carbs. So my brain didn't have the full bandwidth that it should. But, you know, being able to have somebody that's a trusted source that can create that custom plan for you and your needs, working around injuries, like that's the beauty of having like a doctor of physical therapy that understands programming, because you're not going to just say that hurts your shoulder, well, just don't do it. You're going to find other ways to target whatever muscle group it is to then still get those gains and those results. And then of course here, like all of us, we can do dry needling, blood flow restriction training, all these other things that actually help you work through that pain. So then we're still getting you right back to where we need to be. What else should we talk about?
It's crazy because we can do a deep dive on so many different topics, but like we are mostly a sports ortho clinic with focus on that. But like the testing that she just took was neuro based, like heavy into neuro, and we see a lot of pediatric, women's health. What am I missing? Like
I mean, everything, neuro, spinal cord injury, stroke, like you have to know like everything across the board in general. So poor Dr. Diana's brain has just been like put through the ringer. And if you gave me and Dr. Nicole that test and you asked me about a asymmetric tonic neck reflex, I'd be like, what? Anything ortho-based, so we're like, yeah, we're golden. It's good. It's good. So I have to ask, like, whenever I took my boards, I just still like had those panic dreams, and it wasn't panic that I failed the test. I actually like felt pretty good about the test. But it was panic dreams that I still have to study for something. I had another PT school exam and I forgot to study
You
for
really
it.
did not pass. They were going to revoke your license. Just kidding. You did all of this work and yes, you got it, but nope.
I think my body's still a little bit in fight or flight. I like wake up and I'm like, I have to do today. Oh my gosh, should I just study before I go to work? So I think it'll get there. I'll relax a little bit as time goes on, but
How do you relax?
I like to read, I like to work out, I like to sleep. I hang out with my cats, my husband.
When I say like Dr. Diana is probably like one of the most regimented people I know. Like as far as like, yeah, because you're always just like, oh, like I'm gonna, you know, go for my hot girl walk, and then I'm gonna, you know, go by the pool and like read this book, or I'm gonna do that. But it's like everything that you do is like, oh, like that's health and wellness. Like that's cool. Whenever it's me, I'm like, oh, yeah, I just had like an insane week. I treated
You treat
60
insanity
hours.
with insanity.
All of these people like, yeah, let's throw a party this week. And that sounds like a great idea. Or, you know,
My peace.
let's go on this like sporadic trip and go just be social the whole time. And then I just crash and burn like once every 3 to 4 months.
I'm a calendar person. I'm a planner person. I've already planned like my day.
Yeah. And I love that. And I used to be like that. And then the second I opened Real Recovery, it's like I have the plan.
It's a baby.
It is a baby.
It changes your life. You have no life anymore.
So I think that's a good thing for us to talk about. So Dr. Nicole is a mom of 2 awesome boys who are growing like crazy. I feel like I'm like auntie status of getting to watch them like grow up and how much they're moving. But how would you say just like your perspective on health and wellness routines and learning how to give yourself grace when you went from like Dr. Nicole, also super regimented, like worked out all the time, was getting her macros in. We'd be in the office of the PT room. She'd be like, hold on, I got to get this chicken down real quick, you know, all of those things. And then I know like motherhood kind of hit a little bit.
It was a little bit of a perspective wake up, but I needed it because prior to kids, could not understand why people did not want to do their home programs. Like, why? This is great. Movement is great. I love exercise. Why don't you love exercise? Why can't we all be on the same page here? It's very simple. And it's not that simple. When you have life thrown at you and you're in control of many different things and you don't just have a college or a bachelor lifestyle to do whatever you want, it was a really good perspective for me to have and to get out of shape or go through an injury, because I had 2 C-sections, recover from those, feel different kinds of pain, all while under the constraints of not my own time frame. Kind of learned that, you know, exercise, yes, still is king as far as improving a lot of pain and getting you where you need to be in the long term, especially if you have specific goals that you want to meet. But it's sometimes not a reality for everyone. And so like that's what I really love about Real Recovery is like we give you all of the tools that you need, but when you're having a really hard week and you just need to come in for some feel good, like you got it. And that sometimes is your mental health that puts you on the next step to being able to tolerate the second step because you're now believing in that next step.
Yeah, 100%. Like we're never going to have a patient come in and then be honest and vulnerable with us of like, it's been a week, I've been stressed out, or even, you know, our kid athletes, right? They're like, coach has really been on me, or mom and dad have really been on me this week. Just like, no, I didn't get to those exercises or whatever. We're not about to like yell at you, make you feel bad. Like not at all. We're gonna be like, hey, you know what? We get it. Life happens.
It's not linear.
But yeah, so let's do what we can today to kind of make you feel better, or let's get you back on the train with the exercises, and then we'll just roll from there. And I think like giving your patient grace like that.
And teaching them that grace is okay to give themselves.
Yeah.
Like that, especially with our athletes, that's a really, like, we talk about perspective. It is something that you have to learn yourself, I think, but just to have someone coaching you that gives you the grace, because a lot of the times their coaches are not giving them the grace. Every step, every time they turn around, they're getting, you know, the next thing thrown in their face, and it's go, go, go all the time. So the mental health is important to know that you have a team that's supporting you in that kind of way too. Because we've been there and we know it.
For sure, yeah. And even just like regaining that trust with your body, right? Like when we work with athletes who are used to being the best on the field all the time, like has never struggled with the exercise or anything like that. And then, for example, they blow out their ACL and they get their ACL repaired. Dr. Diana was working with somebody just the other day, like trying to get him moving on an agility ladder again and learning how to land from a jump, because getting onto the step wasn't the issue, but actually properly landing from it was. And there is definitely like a mental capacity.
Exercise routine and was expected to perform the same way no matter how they felt, and the people that actually listened to their body performed better in the month's time.
Yeah.
I think so.
Yeah, and I can't tell you like how many just conversations that you just sit down and have with a patient. They're just having a bad day and they just need to talk, and they need somebody to listen. And exercise, we get to it. We'll get to what we need to, but they just need somebody to sit and talk to just clear their mind, have somebody to talk to about it.
Yeah, and like here at Real Recovery, you have the opportunity to do that because you don't have 5 other patients that you're like now responsible to get through the door,
sure.
but you can take your time and kind of really build that rapport like with that patient and athlete. Definitely. So I think I'm curious on hearing from you guys, kind of like if you had to describe Real Recovery versus other clinics in like a quick, just kind of straight up way, how you guys would kind of explain that to somebody that doesn't understand why Real Recovery is different from other outpatient orthopedic clinics. And the second part would be kind of like where you're excited for our growth of like what we're doing, things that are happening, and all that.
So I think like Real Recovery to me, it can be very tailored to you. It's whatever the patient needs that day. If we had been treating their neck and they're like, man, my elbow hurts today, we'll take a look at it. We don't need a new referral. We don't need insurance to say okay. We don't need work comp to be like, sure, I guess so. We can kind of do whatever the patient needs that day, and I think that's like the most amazing thing, that we're not restricted in that.
Like something that you're excited for that Real Recovery is growing to, or where we want it to grow to, or?
I just think that Real Recovery is like really expanding, and it's all about the patients. And so every conversation we have is like, what can we offer the patients next? How can we make Real Recovery better so that the patients get the most out of it? How are we reaching the most patients? How are we getting new patients in? Like, what can we offer? How can we be better? That kind of stuff. So I just think we're always excited to grow. We're all like really energetic, and we're wanting to be better and give our patients the best. So I'm excited.
Yeah, love that.
I mean, I think it's how I feel working at Real Recovery too. I feel like I'm treated as an actual person, not just an employee, and I feel like we treat our patients the same way. Like, they aren't just a patient, they're a person. And so when they come in, it's a full body kind of thing. It's not, I have an ankle today. It's, oh, Ashley's coming in today. How's Ashley doing? And I feel that way working here. I feel like when I walk in the door, I'm somewhere where I want to be. And I feel like our patients kind of feel the same way. They come in excited. They may not want their injury, but they feel like at home that we are the kind of care that they want to give or get. When I worked at previous clinics and physician-owned practices and everything was a number. It wasn't about figuring out the full patient. It was get in, get out, get more in, and that's
Patients.
And you didn't have time to get to know someone or understand them, and that's again where the uniqueness of Real Recovery is, because I didn't even have that perspective when I gave my home programs or when I gave my exercises or when I programmed anything for a patient, because I was only thinking about their injury. So I only prescribed based off of their injury and based off of what I was told in school, instead of evaluating a full patient and giving them what I thought, like, hey, Ashley, let's talk for a second. What'd you do today? What do we have time to do today? Important stuff. And you just don't even have time to think about that in other clinics. So I'm excited for our next move. We're going to be moving buildings into bigger spaces and growth with good partnership, I think. And just being able to kind of tap into that athlete population a little bit more and get a little bit more concise with our programming. I think we're going to have a couple cool developments in programming specifically for like golfers, and just really getting a little bit more specific with our actual population specific programming.
Yeah.
So I'm excited about that.
Yeah.
A little bit of organization, like Diana said, but I'm kind of like, I'm half and half. I'm type A and type B. I'm
full time.
Yeah. I'm wondering, I still try to identify as type A, but it's just not there anymore. I think that ship has sailed. Yeah, you guys have to really reel me in sometimes, because I get so excited about like all the big things and the logistics. Sometimes I'm like, it'll work itself out. But no, in general, like, I'm just super stoked for where Real Recovery is at and what it's grown to since I opened it in December of 22. It was a one-man show. It was me, and I, by golly, was working 7 days a week. If you told me the only time you get in for treatment is Sunday at 7 p.m., guess where I was? Right there in my office, ready to see you. And since then, I've met so many amazing people, so many amazing doctors as well, and just being able to have the team grow and to have everyone kind of believe in the mission. And it's just, I feel like it's really spreading like wildfire now.
That's the other thing. I think that's a big difference in Real Recovery is we're humble. Like, we know our limits. We have a lot of contacts with a lot of different people within the community and everything. We know who to refer to when we need to. And it's not all just a macho, hey, we're the best in the field about every single thing. We collaborate a lot.
For sure. Like, yeah, if you come in with any of our doctors and we evaluate you and we're like, actually, no, think we need imaging on this, or hey, this is actually looking pretty rough, let's get a surgical consult and let's just work together as a team and see what the surgeon has to say, right? Like sometimes all those things are definitely necessary. And so it's been really cool since we've done the hybrid insurance option a little bit. Patients are starting to realize the limitations that insurance puts on them whenever they go that. But, you know, if you did just have a surgery or something like that, it's great to be able to have that direct referral over, and then we can just take it and run from there.
Right.
And then progress them back into life, not just off of crutches to kind of somewhat walking, but let's get them back running again and everything else too. So there's a ton of fun new things that are coming for Real Recovery. For example, the Ladies of Real Recovery, the podcast talk will continue. We'll make this a regular thing. So if there's anything that you guys want to hear us talk about, have any questions, definitely let us know. We're really looking forward to it. And I'm not going to give too much away, but Tallahassee, big things are coming. All right, you guys have a good one.